Welcome to the Psych to Practice podcast, your one stop for practical and useful clinical information, masterful insights from experts in the field, and a guide to daily living. I'm your host, Ray Christner, and today I'm flying solo. So Paul's not with me today, but I had the opportunity to do a Masters in Practice episode with Dr. Jessica Kendorski, who is a friend of mine and I've known for a while, and who really just has great expertise and insight regarding applied behavior analysis. And really kind of our goal today was to really talk about what it is and what it isn't, and a little bit about why there's been some kind of strong reactions to ABA and why maybe that's not necessarily the fact that ABA is not a good process, but maybe a misunderstanding of what it is. And the fact that maybe there's just services that have been applied out there that give a bad impression. And so we really talked through a bunch of general aspects around ABA and even about how it could be used really in different settings and not just with kids with disabilities. I had a great episode. For those of you who do not know Dr. Kendorski, she's a professor and department chair at Philadelphia College of Osteopathic Medicine, and she's also a licensed psychologist and maintains certifications as a board-certified behavior analyst and also a nationally certified school psychologist. Jess actively consults with school districts to improve systems through reform of school and school district-wide policies and practices, and she also works with parents and families related to development of supportive home environments and really looking at promoting both child and family well-being. So I hope you enjoy this episode, From Clinics to Classrooms, the expansive reach of ABA, a Master's in Practice with Dr. Jessica Kendorski. So Jess, welcome to the Psych to Practice podcast. Thank you so much for joining me today.
No, thanks for having me.
Absolutely. So, we got a lot to talk about in a short period of time, but we always like to start off giving kind of our listeners a little insight to who the guests are. So we like to kind of say we try to get a little origin story of sorts. So tell me a little bit about how did you get into psychology?
Yeah, sure. So as an undergrad, I was a psych major. And then what was interesting is I went to a faculty member when I was a junior as an undergrad. And I said I wanted to go to grad school. And I was thinking development. I wanted to work with kids. And I still remember, and I tell students that I have this, she said to me, if you want to work with kids, I'm a developmental psychologist, but what I would do if I were you is I would look into school psychology programs because then you can get licensed, but you can also work with kids and you can work with systems and it just kind of broadens, whereas you might be more held to academic research type positions if you went solely development. I took her advice. I applied to development programs. I applied to school psychology programs. I decided to go to Temple's PhD program in school psychology. While I was there, I worked in the neurobehavioral unit at Bancroft in New Jersey, which was basically a pretty restrictive type unit for kids where it was almost a last ditch effort because they had severe aggressive and self-injurious behaviors. What we did there was, and I was boots on the ground, so I was direct care, right? So what we did there was functional analysis and implementing behavior plans. Mm-hmm. And I had amazing supervisors and I continued doing that all through grad school. I worked my way up to being a supervisor. So I went a very unconditional path a little bit to behavior analysis, but that's how I found my way. So as it stands now, I'm a licensed psychologist. I'm a board certified behavior analyst, and I'm also a certified school psychologist. But my behavior analytic and my interest in systems and dealing with children and families with severe behaviors basically came from my job while working as a grad student.
Yeah. And I think everybody should have to work in that kind of a setting for a little bit. You do learn a ton in that short kind of stint that we do in those settings sometimes, or just, it's incredible. So that was your ABA foundation, which is good. And I guess that's a good way for us to kind of maybe bridge into the topic. So we're going to talk about ABA. I oftentimes, when I talk to families or just people in general, when we hear ABA, we think about autism support and that's the focus. I think ABA is so much broader than that. Can you maybe kind of give listeners kind of a quick overview of like, so what is applied behavior analysis? Like, what is it and what is it not, I guess?
I'm so glad you asked because I love that question. What I will often kind of nutshell before we get too academic, what I often tell students and schools and people that I work with is many of us got into this field because we wanted to work with kids, right? And that's great. And we do. But what I think we need to understand as child psychologists, school psychologists, behavior analysts, our primary task is to change adult behavior. And in order to change adult behavior, you have to bring the adults on board. You have to understand what they value, understand what they connect with, understand what it is that their goal is. And behavior analysis at its core is changing the environment and the context with which a child is in order to have them achieve to the best of their ability. So what does that mean? You would change the behavior or you impact the behavior, maybe not change, you impact the behavior, you support the behavior of the adults around them so that the child can meet their needs.
Yeah. So now that's totally different what most people think, right?
Mm-hmm.
So everybody thinks we're just focusing on changing the child. And I think that's super important, but I think difficult. Like, do you find that you get resistance when you share that with people? That's, hey, we're changing everybody in the environment. This isn't just about the child doing something wrong and we're changing that.
Yeah, of course. Right. And I think it makes perfect sense because when we bring our kids who are having difficulty as parents, as teachers, we don't want to see them struggle. Right. So we want to be able to say, okay, can you just fix this? Right. And then when it's like, well, yeah, but we are probably going to focus more on all of the adults than we are with the individual child. I think in a lot of ways, applied behavior analysis gets such a bad rap sometimes because it looks like it's control. It looks like it's discrete trials. It looks like forced compliance. And at its core, it's really about what I think is probably the most positive of the psychological practices in that at its core, you're saying every child can succeed. Every child has strengths. If we work with the environment and we work with the child's strengths, then we can have this child live the best life that they can. So at its core, I feel like it's quite positive. And the way it's gotten almost the control aspect, I think is, just because you've seen a clinician not implement something the way that it should be implemented doesn't mean you throw the whole theory and the whole practice out.
Yeah. I think that's a great point. And I want to kind of dig into that here in a little bit, because I think that there are such strong reactions around it. And it's strong reactions about bad service, not a bad theory and process. And I think that differentiating that, and, it's not to try to simplify this, but I always oftentimes tell parents, I think probably one of the best simple ways to see ABA is anybody that's ever watched The Dog Whisperer, right? Like, it's like, which is, simplifying it. I know we're talking about more like human behavior, but in general, he says, listen, I don't train dogs. I work with humans to change their behavior and how they interact in the environment, which then allows pets to behave more. And I said, it's really, when you watch it, it's a very positive thing. It's why the show was so popular in general and no one questioned it. But if you watch him, he's just doing really good behavioral interventions. That's what it is. With the humans.
So I like to think that ABA at its core, you look at Rogers, it's very humanistic. And I don't know if Skinner said this, but I did have a mentor tell me one time, the rat is always right. And I've never forgotten it. And sometimes I will tell my students at PCOM, if more than 80% or if more than 20% of you fail my exam, I'm going to look at me, right? Because something happened with the educational experience that I was giving you. So if we look at the triangle and more than 80% should respond, if more than 20% of you are not doing well in my class, I'm going to look at what I'm doing. And superficially, that goes back to the rat is always right without saying it that way. But it's the same thing. Like, what is going on in the environment and how can I alter things so that everybody can meet their potential?
Yeah, I love that. So such a great example in college. And I use that often when I'm in schools. I'll say, we have 10 referrals out of 20 students in a class. There's probably something we need to do systemically, not try to individually do plans for all 10 kids. So, I mean, that I love that. I think it's a great kind of piece to it. So let's get into some of the details here of ABA. So, I know prior to us recording, you kind of mentioned a little bit about dimensions of ABA. And I thought maybe it would be good if we just kind of went through those to help listeners really kind of understand those 7 dimensions. So can you kind of share a little bit about what they are and kind of why they're important?
Sure, of course. I think what has become one of my pet peeves is when people say, I don't want my kid to have ABA, or my kid is getting ABA, because ABA is not a thing. It's not an intervention. It's an overall framework. And it's a framework embedded in specific principles and specific dimensions. So the first dimension is, as the name implies, it's applied, right? Which means it makes sense. So any intervention for a child that involves applied behavior analysis should be applied. It should be something that matters to the family. It should be something that matters to the child or the adult. It should be something that matters to the society. It should be something that translates and makes sense. You have to be able to define it. So we have to be able to define a behavior in order to change it. And what I think behavior analysis shows is that you can pretty much define most anything. If you can name it, you can change it. So if you're able to name that behavior, name what you're saying, you can change that behavior. It has to be analytic. So you have to be able to collect data and be able to see, okay, here's where someone was. We implemented this, or we didn't implement it. The world implemented it. This changed. So what can we look at to say, what is the function of what is going on? What is the issue we're seeing? It should be technological, meaning I should be able to explain to you, Ray, anything that I'm doing, and you should be able to do it as well, right? So if we're implementing an intervention, we should both be able to do it. If I can't lay it out for you, I don't understand it. I don't know what I'm doing. And if it doesn't translate, then it's not technological. It's systematic, so it's evidence-based. So we build on literature that's already in our body of work as behavioral scientists. Should be effective, meaning that it's data-based. If something's not working, you're collecting data to see that it is working. And then I think probably one of the biggest things is it should be generalizable. So something that works in the classroom should work in the home, should work in the playground, should work in the restaurant. And you have to program for that generalizability. You can't just hope that it happens, but it should be generalizable. I know I went through those quickly, but that's the overarching framework of applied behavior analysis.
Okay, so I'm gonna make sure I got them all right, because if I got them right, then everybody else will get them right. So applied, so behavioral, so that's the definition part. Analytic. Technological, systematic, effective, and generalizable.
Yep. You nailed it.
So 7.
I'm looking at you. You did that completely without taking notes.
Took notes, mental notes. Yeah. So I think that's a great way to kind of, again, and you kind of said this idea that it's really not an intervention. It really shows this is a way of thinking, right? Yeah. So it's a process that we have to go through. And so I guess like in your work, where do the difficulties come in? So in these different dimensions, like, are there certain areas that clinicians or families or those using ABA, they struggle the most? Like, are there certain areas that are more difficult?
Yeah, that's a great question. I think so. In addition to my work as chairing the school psych department, which has an applied behavior analysis program at PCOM, I use these principles in that. I mean, they can generalize completely to higher ed, but I also do systems consultation with local school districts. And when I find that there's like this disconnect of like what doing ABA is, whatever that means. I find that it's usually something's not applied. Mm-hmm. So it feels like whatever the behavior analyst is doing doesn't align with the parents' values, doesn't align with the school's values, doesn't make sense. They're like, oh, we're spending all of this time with touch red. And if I feel like if you can say, maybe touching red is important, we want colors, right? But if we can bring the parents in and consult with them, bring the teachers in and say, what will improve the quality of life? What do you value? What matters to you? So I think the applied thing, and then I would also say the generalizability. Yeah. So we don't always program for generalization. We just hope that it'll generalize. And what we know is in the same way we apply these principles to systematically program for generalization. You can't just hope that it'll occur.
Right. Yeah. So that's interesting. That's interesting. That's what I was thinking as well. It's kind of like, I think the difficulties are on the front end and the back end. That the idea of not only the applied piece, but I think really defining behavior operationally, like where that people really, like everybody knows that that's the behavior we're working on, that there's clear kind of things. That I think that front end, because if we don't understand what it is or what we're shooting, that's difficult. And I think the generalizability pieces, I love that you said programming ahead for that, because that's not an outcome. That's part of the actual process. Like, it's not just that it's generalizable. I tell families often, like, we should start talking about that today. Like that day one, we have to figure out that how do we get that to happen? What's the practice that's going to happen? Real world practice that makes it generalizable. So yeah, I love that idea. The middle stuff I always find kind of falls in place if we have good bookmarks at the end.
And I love that you bookmark them too, and they are like completely bookmarked. I would say related to what you said with the defining of the behavior, I think, and this relates to what you opened with. I think some of the conception is that there's a reductive aspect to things. Like if we reduce everything to defining behavior, we're reducing the complexity of humans. Yeah. And we're not. So if you look at acceptance and commitment therapy, if you look at radical behaviorism, most people think that radical behaviorism is just this kind of control. Everybody is just stimulus response. And it's not. It's like, if we can define things, we can be a behavioral science and we can really make steps to changing things. So even our thoughts can be defined, right? Even a thought that occurs that might be an antecedent to having us behave a certain way and get a certain consequence can be defined. So that reductive aspect is just not the case. It's complex behavioral science.
Yeah. I guess kind of your opinion on this, but we talked a little bit earlier about like that sometimes ABA, and I think maybe more now than in my early career, there's this strong reaction to people. I mean, some, being very vocally against it. So I mean, in your perception, like what's the misalignment there? Like what is there things that you kind of see that you think are misunderstandings that are promoting that?
Yeah, I think from a preventative standpoint and somebody that, directs a higher ed program training behavior analysts. Yeah. So we really try, I feel like in our programs, and I think what's important in all programs, to train psychologists that are good behavior analysts in our psychology programs, but also to train behavior analysts that really understand human development and psychology, but also consultation and systems. And when you look at the task lists from ABAI, and from the BACB, it's all in there. But I think when people have contacted kind of, I'm going to do behavior speak, but like a negative type contingency or consequence with behavior analysis, I think it's because the understanding of human development, the understanding of the complexity of people. But I think the missing piece is that consultation piece. Yeah. So what are the values of the family? What are the values of the school? How are you working with the adults? Again, remember, going back to what we said in the beginning, if you're trying to work with adults. They have to be willing participants. And if you're just going in and saying, you need to do this, you need to do that, this isn't working, it's just going to be met with. So you have to put that consultative hat on and say, I got to figure out what will work in order for this person to want to do what it is I'm asking them to do, if I think it'll work.
So this is a collaborative process. I think that's the key, right? It's this collaboration of all stakeholders. And I think people reduce it to it's just having somebody do the same thing over and over and giving them a reward or a reinforcement for that. I love that idea of just getting everybody on board with understanding it. And I think you're right. Consultation, man, I don't care what field you're in. If you can't do that well, it's a struggle. And my experience, I mean, I don't necessarily practice ABA specifically, but of course do a lot of behavioral work as a psychologist, it's, but when I have families who have come and said, I'm not doing ABA anymore. Like it doesn't work. I always go back to like kind of talking about, so what went wrong? Like, where did you see the difficulties? And that's where it's always, it really does come back to feeling like they were told to do something rather than really talking about what was meaningful and functional. I mean, I had a family just recently, wonderful family with a child that has some significant difficulties, an adolescent, and the parents just want him to independently be able to use the bathroom. That's it. That's really what's meaningful. And the team was so worried about getting him to say other words and to work on that. And so the family was frustrated, and they're like that's like, if he says 50 words, we really don't care. But for us as a family, the idea of him being able to be more independent. Now, whether that's full independence or not, yet to be determined, but that's the direction they wanted to go. But no one listened to it. Instead of working through it, they said, we're done. We're just not going to do this anymore. So yeah, I agree. A consultation, I think, is super important in this process.
Yeah. And it's everything, I feel like, to ask a parent, what is it that you value? And talk about being applied. I mean, having a child go to the bathroom independently will be a game changer in his quality of life. So it should be something that's prioritized over that. Yeah, I do think if we look, it really is that consultative approach and, just asking people, is this something you're going to be able to do? Because a parent will tell you sometimes you could put a high response effort behavior plan in place and then just say, oh, well, the parent didn't do it. And it's like, the parent was crystal clear that they work full time. They have 3 other kids. They cannot do this. So what I like about behavior analysis too, and what I challenge students and clinicians to do, is be creative. Like, there's a creativity aspect to this. If you find that you think this would work and a parent's like, I can't reasonably do it, you don't have to say, oh, well, there's something wrong with the parent. Get creative. There's always a way. I'm sure Skinner would always say, there's always a way.
Right. I'm so glad you brought that up, because I think that's, again, why does it seem so burdensome to some families? And it's like this idea of that your whole life is about this reinforcement schedule. And I've had families who have said in the past, like that's all I do. Like, I just want to be a mom. I just want to, I just want to do mom stuff. I don't want to do all of these things. And that's what's missing. Like, people aren't creative to go like, okay, like, we have to meet parents where they're at, it's.
Yeah. And I love the point you made, because there's the response effort, right? Like, you're asking me to do something that I don't have the effort to do, but there's also the emotional component. So I've seen some plans sometimes where they're like, hey, if your kid does this, ignore him. And I will know that there's no way this mother or father is going to do it.
Yeah.
And that's okay. That doesn't mean there's something wrong with them. They're like, listen, my kid says he's hungry. If he hits me because he's hungry, I'm feeding him. It's a non-negotiable, right? You have to figure it out. There's a rich emotional aspect of, I just can't do it. And if you can't kind of work through the parent to kind of figure out how to do that, you have to be creative in other ways.
Yeah. Yeah. When you were talking, it reminded me there's an old book from the 80s, one of my favorite books in psychology. And it's not a great title, but it's called Treatment Adherence. And it's by Donald Meichenbaum. Mm-hmm. And it's not really about ABA, but it was really written about medical adherence to treatment for like diabetes and those types of things. But what's great in the book, he talks about what increases adherence and effectiveness of interventions. And the point that stood out the most, and I tell this every time I teach a class, is you have to ask about the barriers. What's going to make this difficult for you? Because I could put a great plan in place, but if it's not realistic in your life, then we're not going to get anywhere. And I think in consultation, sometimes we forget to say, and I've done it. I mean, I've worked with families. I think, I got this great idea. And then the parents are looking like, oh my gosh, what are you asking me to do? But to simply just say, if we did something like this, where's the difficulties for you? And then that's where our creativity, I think, kind of comes to play. And, and it's such a easy thing to do. And just a question I think we should ask more often of people in general.
Yeah, I love that. And you know what I thought of when you said it? You hear this in like the tech fields where they say what you need to do. Like, so when all these social media companies are trying to get us, you have to reduce friction.
Yeah.
And you said with eliminating barriers is reducing friction. So you have to reduce friction. Like if I have to go to this window, to this window, to this window in order to access your podcast, I may not do it. But if you reduce the friction that it pops up when I pick my phone up, I might say, that's interesting. And there I've engaged in a behavior. You've reduced the friction. So I love that you said that because I think a primary job is reducing that friction and those barriers in order to implement the intervention.
I love that term. I'm going to steal that. I like that's great. I like that. I like the idea of reducing friction. That's brilliant. That's a great way to look at it. Mm-hmm. So we've been talking about, a lot about kids and families. And I think, again, with ABA, I think oftentimes people think of special education or developmental disabilities, those types of things. I guess I'm curious, like in your work and in your experience, how have you seen that ABA applied in maybe unexpected or under-discussed settings, like medicine or public health, or like where else do we see the use of ABA?
Sure. So I'm at a med school now. And I will tell you, when I am asked to talk to med students or med faculty at a presentation, it usually may surround some of what you would expect, right? Somebody comes in a pediatrician's office and says, my kid has food selectivity or isn't doing this, or there's issues with that. I would say kind of globally, what the med students get really engaged in and what some of the med faculty get engaged in is, well, I tell them they should eat better and they don't. Or I tell them they should take their blood pressure medicine and they don't. Or I feel like they're having this pain issue, but I'm not really sure. So I see it kind of applied in that way, where what could we do as behavioral scientists? Because it isn't enough. Like we just talked about, maybe there is friction. Maybe this person can only go to McDonald's because there's so many other things going on. And are there ways that you can reduce friction if you want them to eat more fruits and vegetables, let's say? I also see it a little bit from public health. I mean, we've all gone through COVID.
Yeah.
But think of the 7 when we were going through COVID. And when you want the masses to kind of interact in a certain way, and, you can see these 7 principles applied or not applied. And I will tell you, for better or for worse, social media and tech has done a brilliant job of
better at it than anyone.
They've capitalized it completely. Get it? They understand it. They know how to capitalize attention. They know how to capitalize on your behavior. They know how to reinforce it. They've used these 7 perfectly. And nobody says social media companies are doing ABA. They are.
They are.
It's all behavioral science. They are all behavioral scientists, whether they want to be or not.
Yeah. I mean, every time my phone buzzes, I automatically pick it up. That's a conditioned behavior, right? It's no, it's interesting. It's been a while, but I had watched Social Dilemma, which is, if you haven't seen it on Netflix, brilliantly done documentary. But that's all I kept thinking about. I'm like, wow, like they have taken everything that we know and they've created an algorithm that does all of these things in incredible time. I mean, it's just even the fact of, I was actually, my daughter and I were doing something and I had showed her, I was scrolling through my phone and I stopped on a video of content that I could have cared less about. But I just watched the whole video. Scroll a few more, now another video of the same or similar content popped up, same person. And then now all of a sudden, like, I can't get rid of this content. It's not even anything I'm interested in. But the crazy part is when I stopping on it, then it starts decreasing. Like it even extinguishes basically that of, it's incredible. It's a really interesting. Yeah. I think they do it better than anyone.
So they get it. I mean, and I've seen Social Dilemma. I actually have my students watch it in my theories of learning class. And, what's fascinating about that is that you see so many of them say, I would never let my kid have a phone. And also what I've learned, and I'm the parent of two teens, 14 and almost 16, is when they said, if you want to know what your kid is interested in, you don't have to look through their phone at their text messages and those kind of things. Just scroll through their feed. Because the algorithm will tell you everything, which is very similar to what you just said. You randomly stopped on something, it would extinguish. But if, you wanted to know if your child was exposed to constant eating disorder type content, if you go through their phone and that keeps popping up, it's probably because it was something they watched.
Wow. Yeah. Yeah. It's amazing. I mean, they have done a great job. Now, do you see is ABA applied in other business contexts? Is it something where again, we think of behavior in more of these individual ways, but what about systems like behaviors or even school-wide systems?
Yeah. When you said business, I was going to say, well, I'm going to go right to school districts because I think it's almost the same. It's very similar, right? So if you look, or even higher ed, if you look at the way the approaches to systems and how they can be successful, you'll see a lot of these applied behavior analytic approaches. So some of the stuff that I do is I will go and consult with school districts that have been identified for whatever reason. Maybe they're not meeting progress. Maybe they're labeled persistently dangerous. They're just red flagged. And it always comes down to looking at those systems, but looking at those universal systems. Because it's like you said, if you have 10 kids in a classroom that need individualized support, we just don't have the means for that. It's like I said earlier, if 20% of my students are failing my class, it's got to be on me. I can't individualize instruction for 20% of students. I have to kind of fix that. So yes, I do think when you look at systems and you look at waste and you look at efficiency and you look at business and you look at making money, you can definitely look at these principles and say, are you using data to make decisions? How are you kind of emphasizing your universal procedures to make sure that they make sense? How are you impacting and looking at what your employees value? And if it makes sense to them, and if you're asking them to do something where you just know, I'm sure we've all worked for organizations where you're like, nobody is going to do this. And I don't know why you didn't figure that out before you asked them to do it, right? Also with PBIS too, not to get in the weeds, but with PBIS, which is positive behavior interventions and supports, which is usually the systems approach to schools, it gets away from the punitive approaches. So what we know are the positive approaches tend to work and they tend to last, and you can implement them. Your aversive approaches, you have to implement them every time a behavior occurs, which it's almost impossible to do. So when you look at PBIS and you look at these principles, you can see universally, I can reinforce everybody intermittently for doing what they're supposed to do, and it's going to work. But every time somebody doesn't do what they're supposed to do, I can't catch every single one. So an aversive approach is not going to work. And I think you see that in your schools, but you also see that in your businesses as well.
So this is something I know the answer to, but I'm going to call it out because I think that a lot of people don't. You kind of went to the PBIS, so this positive school behavioral support, and we're talking about ABA. And I think a lot of times people see these as two different things, and they're not. So when we're talking about applied behavioral analysis, this is, I think people, again, they think of it as this really narrow strategy, but it's a much larger piece. Anything we're doing behaviorally as an intervention falls under the umbrella of ABA.
Yes, that's why those, going back to those 7 are so important. When you are looking at behavior systematically, you're analyzing data, it's just good practice for everything. Whether you want to stop smoking, whether you want to walk more, reducing friction, like we discussed. Yeah. If you're in businesses and you're a manager and you're like, my employees are not doing what I ask, figure out what the friction is, figure out what their values are, figure out what you're asking them to do. Again, if you can name it, you can change it, collect data, be systematic. So PBIS is I would say, under absolutely the umbrella of applied behavior analysis. And if anybody brings anything away from this podcast, it's that this is a framework and a behavioral science, and you don't do ABA. And maybe if you had a clinician or you worked with somebody and what their idea of doing ABA was discrete trials or a token board, or it was just, it's like throwing out radiology because somebody read a scan incorrectly. You don't do it. So,
That's a great way to look at it. So kind of in line with that, this might be a hard question to answer, but let's say we are going to do ethical, family-centered ABA in practice, whether that's at home or school. What's that look like? So if we're moving beyond this, just kind of this simple discrete trial, what does an ethical, family-centered practice of ABA, how would that look to people?
So I would say for the listener, they should go to acceptance and commitment therapy if they're interested, and do more. And maybe we could do a follow-up podcast on that. Yeah. But I think that paints a really great picture of how to start with consultation, how to start with values, how to not discount kind of verbal behavior and internal dialogue, how to understand that your thoughts and your emotions can be defined and they can be changed if you want them to be changed in order to improve quality of life. Starting with what are the values of the family, cultural issues, just not coming in and saying, oh, well, I saw that this could really work for, let's say, a child who is punching holes through walls, and saying, okay, let's sit down. Having a parent understand, I'm going to be asking things of you. So I want you to tell me, I can't do this at dinner time. Don't ask me to do it. I can't. And then we'll think creatively and we'll figure it out. But really, I think the most important thing is that consultative aspect from the beginning, and figuring out what the values and goals of the family are and how you can help support that not just the intervention that was just published in JAVA and works.
Right. Yeah. No, and I'm glad you brought up about like ACT and kind of these kind of third wave cognitive behavior therapy approaches. And I think sometimes we get lost in realizing that CBT is so grounded in, it started behavioral. And we've just kind of evolved and we see these waves, which is, I think, important for people to realize they all are so interconnected. But with that, I guess, there's all these models that we hear about now. There's trauma-informed care, there's relational approaches, there's neuroaffirming practices, culturally responsive practices, all these different things. How do you see kind of all of these models, or maybe we can't take all of them, but how do these things intersect with ABA? I mean, you kind of mentioned a little with ACT. So if we have somebody who's saying, neuroaffirming practices are important to them. I hear people talk about these as being contradictory of each other. But if I'm hearing you, there's an intersection that happens. Can you maybe talk about that?
Yeah, sure. I don't think it's zero sum at all.
Yeah.
And I think if you're doing strong behavioral practice and support, you're going to be trauma informed, right? So you're going to do a strong clinical interview. You're going to find out, I don't want to do like the behavior speak, but you're going to find out what a setting event is, what an anesthetic could be. Like your analytic process is going to figure out, okay, this is a trigger or an antecedent, or could possibly be a setting event. And you're going to work to prevent the inappropriate behavior that may not be working for the individual by neutralizing and trying to prevent those setting events and those triggers, which could very much be trauma informed. When you're neuroaffirmative, for me, I feel like it's just really being strength based. And it goes back to when we talked about behavior analysis is very humanistic. It is like, okay, every child can achieve to their best of their ability. So how can we work with the environment to make sure they can? You can't do that well without being neuroaffirming and without being strength-based. So yes, thank you for asking that question, because the fact that it's zero sum with all of these things is not at all. They all can fit under the umbrella of really good behavioral science, which we're all under.
So the big overarching umbrella is behavioral science. It's how these things intersect underneath it that get, I think, confused. So I guess maybe kind of another question just to think of. I'm just kind of curious, we've talked in kind of some general terms, but knowing that you've done a lot of work with schools and things, can you give us what was a meaningful difference that you saw in a system based on doing ABA work? Can you give us kind of an example of what a good difference was after doing behavioral consultation?
Yeah. So I can. I feel like I have a few, but the one I remember is I was consulting with a district in an urban area. It was pretty high crime. It was labeled persistently dangerous. And I was collecting data on the adults. We did positive behavior interventions. And so they were promoting positive behavior and they had their expectations. And I was in the lunchroom and I was just watching the adults to see if they were saying, oh, that was great being respectful. That was great. And there was I guess they were first graders. And this kid just kind of tackled this other kid. And the other kid was like, hey, be respectful. That was one of their school-wide expectations. And I thought, oh, this was so great because I was only in there for the adults, right? But there was that assertive component. It was clear. It was concise. It was be respectful. And I guess my second one would probably be the adults. Because when I go in and I consult with districts and sometimes there's just certain schools that there's a culture of aversive control of behavior, kids should be punished for these things. And then, when we're in there for a year and then you just see that teachers are they can breathe. right? And the positive approaches have worked, and they've just realized that maybe this kind of aversive control wasn't giving them what they thought it was because it wasn't working. And then they kind of come out and there's a change of mindset from punishing behavior to teaching appropriate behavior is something that is beneficial for me.
I think that's a great example because, I mean, what a rewarding kind of seeing that kind of happen. How rewarding as a consultant to see those changes is great. So, well, as we're kind of wrapping up here, I guess, for those professionals maybe that are doing ABA or maybe even outside of the ABA realm, I guess, what would you say your 3 kind of takeaways you'd want people to walk away with in understanding ABA from our conversation?
Okay. So the first I think I would go to, it's about relationships and adult behavior. Right? Or we say adult because I'm child focused. Whoever is around the person who is your client, it's about working with their behavior, figuring out what their values are, working within the context of where they are, and what their goal is. I would say the second thing is, you don't do ABA. It's not a thing. It's a framework. So if somebody says they're going to do ABA, I have no idea what that means, but you can always go back to those 7 and figure out, okay, does this fall in line with the framework? And I guess the third thing would be, I really do believe, as somebody that has been in this field, it's humanistic at its core. It is strength-based. It is when done well, it's strength-based, it's neuroaffirmative, it can be trauma-informed. It is all of those things. It is assuming at your core that somebody can reach their fullest potential if we arrange the environment. It's getting away from the old medical model of somebody is broken, we need to fix them. It's not pathologizing. It's saying, no, there's nothing wrong. Well, there's something that's not working, but this isn't a broken, pathologized person. If we arrange the environment, we can improve the quality of life within the values of the people within the values of the child and the people who love this child. And it's very humanistic at its core. And that I feel like we've got a bad rap for.
And I think that's the piece that people need to talk more about, right? Mm-hmm. I mean, and I've seen that in even cognitive therapy. In early cognitive therapy, people saying, "Well, relationship doesn't matter," and it's like, does who? Like, I mean, it's like, and I mean, it's interesting. I mean, one of the recent books I did, we did a whole chapter about relational CBT because of the idea of. And it's always been part of it, but really calling out how important that I believe without those relationships, we can't do any intervention. I don't care what type of or approach we're going after. But I do think in the behavioral aspects, we just don't talk enough about it.
No, I agree completely.
We know kids will do more for those they have relationships with.
Exactly. We've come out of that medical model.
Yeah.
Our schools are in that medical model as well, right? We're in that like test place. We've come out of that pathologizing, focus on disease. And I think the hope is that we're coming out of that a little bit. And I think psychology will come out of that too.
So my final question, and I always say this is the hardest question I ask. We like to leave with kind of giving our listeners maybe a piece of content that you would recommend that they either listen to, read, watch, whatever it is. So books, movies, TV shows, doesn't matter. What is one piece of content you'd recommend people check out?
Well, what I didn't expect to talk so much about was ACT and acceptance and commitment therapy. So I think that's what I would recommend. Yeah, I think I would, look at some of the resources on acceptance and commitment therapy. And I think it kind of broadens the consultative aspect of applied behavior analysis that I think is so important.
Yeah. Do you have kind of a go-to either site or author that you tend to read the most from?
Oh, yeah. Some of Stephen Hayes' workbooks have been a game changer for me personally.
Yeah.
But also for, I feel like, clients and students as well.
Well, Jess, again, a big thank you to you for joining us on this episode and talking about ABA and some different ideas. If our listeners are interested in learning more about you or about what you do, where can they follow you or find out more information?
Yeah, sure. So I'm the chair of the school psych department at the Philadelphia College of Osteopathic Medicine. We also have a ABA program with a specialization in behavioral pediatrics. So you can find me there. And then all of my information is on the website there.
Wonderful. If you are a licensed clinician who would like more information about CE credits, please head over to www.psych2practice.com. And you can join our email list for upcoming CE exams. And we are now approved by APA, NASP, and BACB to give credits. If you're interested in hearing more or staying up to date with what's going on with Psych2Practice, visit our website or follow us on all social media by searching Psych2Practice. We'll be back in 2 weeks, but until then, be well and stay psyched.